Hello and welcome to Chapter 9, Managed Care and Integrated Organizations. Let's jump right in and be able to talk about what is managed care. And it's actually the integration of financing, insurance, delivery, and payment within one organization, yet it also has the ability to have formal control over the utilization. So providing healthcare services has two features. It's the integration of the finance, the insurance, the delivery, and the payment. But then the other part of that is the ability to control the utilization. So it's important to understand that managed care fundamentally changed or transformed the delivery of healthcare in the United States. The ACA did not create any changes in managed care. The employer-sponsored insurance enrolled fewer than 1% of the employees, and the U.S. care has transferred into other countries so that they are also using similar systems. So managed healthcare grew out of some of the other problems in other of the areas of healthcare. So first of all, there were several flaws in the fee-for-service model. There was uncontrolled utilization. People did specialty care over recognition and paid for extra for that. There was uncontrolled prices and payment. Charges were set artificially high. Insurers were passively payers of claims and didn't really look at any of the information. And then there were inefficiencies that were absorbed by simply raising premiums. So that produced a problem. One of the other challenges that grew managed care was the employer's response to these high premiums. So they started to say, like, wait a minute, HMOs and some of the managed care facilities can keep the prices lower, so why am I doing that? There was also conflict because people were told who they could use and who they couldn't use in some of the other areas, and here they got to have some bigger choices and different things. And then also there was then what we call the weakened economic position of the providers. So providers were sort of stuck in the middle, and it kind of was, well, either you get in or you lose out. So that was the issues. And when we get to the managed care, we also have to talk about the efficiencies and the inefficiencies. So one of the efficiency was that intermediary payer. We got rid of that. There was more risk sharing. And so providers were motivated to minimize their demand and do some quality control, making sure that they made good decisions because they were sharing in the cost or of any testing or stays that were in the hospital. They coordinated all sorts of services and monitored the delivery of those services to make sure that they were cost effective. And because of all the gatekeeping, it reduced any risk for someone to say, okay, that's not going to be all right. Some of the inefficiencies were that there were so many separate deals made that it was difficult to keep track of. Many of the contracts excluded some of the services. So in other words, they wouldn't maybe provide laboratory care or x-rays or maybe nutrition. And so that was difficult. And then the lengthy appeals. When a service was denied, the appeals took forever and people were not well. They were in trouble. And so that created a really difficult time. When you start to take a look at a managed care organization, one of the biggest reasons why they can save money and manage or control costs is because they do have case managers. And so this is an excellent graphic of what happens and how those things are. One of the ways in which cost is controlled so well in managed care is because there each and every case has sort of a management function where it comes to care coordination. So if you take a look at this graphic, you'll see all the different aspects and who decides what's happening. So of course we have the disease management in and of itself, what's going on, what needs to happen, how that goes. We have the pharmacological management, which, what do they need and what's the best care for them. And so once we get sort of all of these things under control and they're managed, then the costs are easy to keep down. One of the challenges, though, is the patient compliance. If a patient is non-compliant, then this triggers all different types of challenges within this system. So there are many types of different forms of managed care organizations, and so you can take a look at those. But what the thing to take a bigger look at, or that's more important, is the impact on cost, access, and quality. So when we start to take a look at the cost containment, there was some angry people because they weren't actually seeing any out-of-pocket savings at the time, and yet they were being restricted on who they could see and what they could have done. When you take a look at access, because of the low reimbursement of Medicare and Medicaid, the doctors didn't want to see them, and so they had difficulty accessing medical care. And then when we take a look at the influences of the quality of care, there's some really good research that shows that there was no real change, that all care was equal. But then when you take a look at that, the backlash, the regulation, and the aftermath from all of those big things, there will be three main reasons for that discontentment. And the one thing is, again, that employers who switched to managed care were saving money on their end, but again, the insured or their employees were not seeing any savings. And the physicians were hostile or angry with managed care because of the fact that they were getting less and less reimbursements and funding. The regulation came out of or developed two types of legal policies or statutes. The first law was any willing provider law, and you want to take a look at that and see what's up with that, and the freedom of choice laws. And so that is something that's really interesting. The aftermath, one more time, after the laws came, they sort of produced some collateral damage or unintended side effects, and there was some scaling back of the tight controls, and the literal healthcare organizations, the managed care organizations, decided to provide or promote relationships with their physicians and care providers so that they could have a better system. And it's improved. The system has improved a little. This graphic gives us a little bit of a picture of how this integration begins to happen and how managed care organizations develop or build. And so there are several forms of integration. The first are the management services. And this is where a group of management, administration, information technology folks come together and bring together some physicians. Then there's the physician hospital organization where there is an alliance between hospitals and local physicians. And then there are provider-sponsored organizations. And this is a risk-bearing entity that incorporated the insurance function into integrated clinical delivery. And so what that means is that we sort of have an insurance company who went out and said, we're going to provide care at this organization, and we're going to control all aspects of it. So that was an interesting prospect. It's important to note that if one of the assignments and one of the things that you'll do for your portfolio is to take a look at all the different integrations and try to find examples within our area of what they are so that you can take a look at that. But the other important factor is that this integration is not going away. This slide says, it continues to intensify. We're growing in this direction, and we're seeing what's happening and how we might disrupt the system of healthcare. And so it's a ripe field for innovation at this point in time. And, how is it related to our public health, and why is it important to understand this system and the way things work within it are sort of pivotal at this time and place that we live in. Okay, thanks. Have a great day.